Hello everyone, welcome back to the Pharmacology Masterclass by Dentospedia, one of the trusted platform for dental board examination preparation. Myself, Dr. Drishtija. Now we will be starting with our third topic, that is prescription writing. It is one of the most important topic in the pharmacology point of view because whether you know your drugs, indications, contraindication, but how to write them in a prescription is very much important. It is one of the most legal document that you can give to your patients. So let's understand this in a very brief manner. So let's start. So prescription is a legal. So it is a legal, clinical, and ethical responsibility in a dental practice. Okay, it serves as a communication between the dentist, patient, and a pharmacist. Basically, it forms a bridge between these three. Okay, and a correctly written prescription should have a safe and effective drug therapy, legal documentation, compliance with the regional regulatory framework, protection from the medico-legal liabilities. Now, different countries has a specific legal requirements that for this country doctor they have to follow. Documentation standards and controlled substances regulation that dentist must follow. This chapter will provide you with a region-wise breakdown of the prescription standards, common errors, and record keeping and legal responsibility for a dental practitioners. Now, what are the essential components of a prescription? A dental prescription isn't just a note, it's a legal document that connects the dentist, patient, and the pharmacist. It must include the clear patient details, the exact name of the drug, strength of the drug, correct dosage, instruction, and the full prescriber details. Following these standard components help prevent errors, ensure a legal compliance, and improves communication with the pharmacy, leading to safer and most effective dental prescribing. So the components of the prescription first has to be the date of the issuing of the prescription, mandatory for legal and dispensing purposes, patient details, full name of the patient, age of the patient, very much important for pediatric doses, elderly also, sex, weight if needed, and superscription. Superscription in the symbol RX. You must have seen in the prescription like this, RX is written. It means that to take though means to take it. That below the RX we are writing our drugs. So it's saying you to take this drugs. Inscription means the drug name, generic or brand. Mainly we use generic name. We have studied it in the previous chapters. And strength of the dose, dosage form. Subscription is the dispensing instruction. That is the quantity of the dispense. That is 325 mg you have to give, or 600 mg you have to give, or 2 ml you have to give of any liquefied drug. Sig, it means the patient instruction, whether you have to take IV, IM 2 times a day or 3 times a day, and how much duration, 5 days, 6 days. These are known as Signa. Prescriber info, name, address, that is our dentist info, name, address, contact, degree, license number, DEA number if applicable, signature of the dentist. That is very much mandatory. Handwritten or secured digitally signature is there depending upon the country law. Now, what is a tip? Always write legible and avoid abbreviation and include purpose for clarity. That is for dental abscess. That in the first thing you have to write the mostly provisional diagnosis if you haven't seen the X-ray. Okay, provisional diagnosis, and after the X-ray you have done, whether it's a CT scan or IOPAR, it depends whether it's MRI. You have to see about the definite diagnosis, so everything will be should be clear, so that if the patient goes to any or other dental practitioner all over the country, they should have a clear cut history of the patient. A country specific legal standard for a dental prescribing. Each country have their own laws, so you have to follow that law, and for your examination point of view you should know about each country basic laws, and whether you belong to any of the countries you should know their all the laws so that you can write a legal prescription. First is the United States, that is having the ADA, DEA, or the state boards must include the DEA number, very much important in the United States for a controlled substance, especially Schedule 2 to 5, we have learned it in the drug schedules. Control prescription must be written, not found in a schedule 2. Electronic prescription is not now mandate in many states for opioids especially. Okay, this is also can be asked as your MCQs, and these are also important. Follow the state specific prescription monitoring programs, that is PMP, and limitation exists on the opioid duration, that is 3 to 7 days in many states. Now, for example, like Dr. Smith, this is the details of the prescriber, that is the dentist. Okay, DDS, license number is this of the dentist, and patient name, and that is name, age, sex, and also weight if required. Okay, that is the RX, that is the super subscription, that is mean by take it or take two, that is RX is written take amoxicillin, dosage is written here. Signa, that is I have told you about the dosage, that is one capsule has to be taken, how much time, frequency, how much duration, these are there. Dispenses, that is 21 dispenses. Dispenses means how much drug they have to take, how much drug they have to take and buy. Refills 0 because you don't have any refills. This is the only dose. If you complete it, then your treatment is complete. Just follow with the doctor, and date of issuing of the prescription and signature of the dentist. Okay, this is the basic format, and especially very much related to the United States. So this is just an example to make you understand. Now, for Canada, narcotic control regulation and provincial guidelines are there. Controlled substances fall under the Controlled Drugs and Substance Act, that is the CDSA. Prescription writing must be compliant with the provisional colleges, example RCDSO and CDHO. Most provinces encourage a triplicate prescription programs for opioids. Okay, this is important. Use of DIN, identification number, is standard. In United States, we are using DEA. Here, DIN is important. Okay, and pharmacists must validate dentist license before dispensing the certain medications. Now, dentists must be registered with the provisional regulatory bodies of the Canada. Okay, in some provinces, example Alberta, electronic prescription must follow the Netcare or the other systems. Now in UK, United Kingdoms, GDC, NHS, and MHRI are being followed. Dentists may only prescribe from the dental practitioner formulary, that is BNF dental section. Controlled drugs like Schedule 2 and Schedule 3 must follow the misuse drug regulation to 2001. And private prescription must include the GDC registration number. Okay, this is also important, can be asked as your MCQs. And NHS dental prescription FB 10D can use only approved drugs. Must use the generic name unless clinically necessary. Now, NHS prescription have a legal limits on repeats and refills, and dentists are discouraged from prescribing a medication not directly related to dental condition. So these are some of the facts that you have to remember. Okay. Now in India, what is that? DCA, DCI, MCI, NPDS Act is follow. Dentist can prescribe any drug relevant to the dental care, must include the registration number, that is a DCI recognized. Okay. And the narcotics, example morphine, tramadol, require compliance with the NDPS Act 1985. Okay, Schedule H and H1 drugs like antibiotics, benzodiazepine requires extra caution record keeping. E-prescription and telemedicine are now allowed under MCI 2020 guidelines. Errors like eligible writing, wrong dose, or off-the-label prescription outside the dental scope can invite legal scrutiny. Now in Australia, AHPRA and BPS and TGA has been followed. Okay. Dentists must be registered with the AHPRA, that is the Australian Health Practitioner Regulation Agency. Controlled drugs fall under the Schedule 8. Okay, if you remember, we have done it in the drug schedule. Requires a specific authority and records. Standardized prescription pads required for a standardized prescription pad required for a Schedule 8 drugs. Dentists can prescribe from the dental schedule of the pharmaceutical benefits scheme, that is PBS, and script must be include the prescriber number and PBS item codes. Most dental prescriptions are very private and not PBS subsided unless explicitly covered. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.